Our next question is from Jonah Kaplan with ABC 11.
Governor Cooper, good afternoon. This is Jonah Kaplan with ABC 11. I want to know, please, what is the threshold for going or staying in phase 2 or even pivoting back to phase 1? Is it 2,000 cases a day, a 50% increase in cases? Is it a limit of ICU beds? And Dr. Cohen, the national headline that included North Carolina this week is the huge increase in cases each day. And today we know no exception. But by our math, we've seen cases up 24% in the last week, but we've also seen tests up 24% in the last week. Hospitalizations up only about 10%, so clearly we want cases to go the other direction. But is this increase in cases really that unexpected, seeing how we are doing so many more tests? So, thank you.
I'm going to let Dr. Cohen address that because they are looking at all of these trends and indicators, all 7 of them in combination, in order to make decisions about moving forward into a phase. And I'll let Dr. Cohen address that along with the second part of your question.
Hi, Jonah. Thanks for the question. And the governor is exactly right. That's why we have said all along, it can't be one metric in isolation that says, okay, yes or no, we can move forward, we can't move forward, because they all interplay with each other. You rightly, I think, were giving an analysis of the fact that we have ramped up testing a lot, which is good news. And so we are seeing more cases. The question is are we just seeing those more cases because of more testing, or are we also seeing a lot more viral spread? I think what we can see is that as you put together the number of cases that are increasing with the percent positive, which is also increasing, makes me have the conclusion that we are not just picking up cases because we're increasing testing, but also because we are seeing more viral spread. I think the hospitalization points us to that conclusion as well. We had been very stable of hospitalizations, around 550-ish people in the hospital day over day for many weeks. We're very stable. And really, in the last 2 to 3 weeks, we've seen that go from the mid 500s to now over 800. That is a significant change, and again tells me that that the virus is spreading more, because we know there's going to be a percentage of people who will become more seriously ill. So as more people become ill, that percentage of people who will need hospitalization goes up. So I think all of those in combination, more cases that we're finding through testing, percent positive going up, hospitalizations going up, I think those tell us in combination that we are seeing more virus in our communities. And I think you can see by the graphs I went through today that timing is very much linked to the last 2 to 3 weeks. It is very much linked to when we started reopening. And I think we knew that when you reopen and you move around more, the virus is going to move around more as well. So I think now it's upon us, every one of us in North Carolina, to say, how can I help keep the virus level low? And I've outlined those 3 things we need to do. One is the 3 W's, wearing the face mask every single time when you're out in a crowd, waiting 6 feet apart, washing hands. The second is getting tested if you've been to some of those high-risk places where you might have an exposure. And the third is picking up the phone to our local health departments in case you have been exposed and they want to tell you about next steps in terms of isolation and getting tested. So those are the things we can do right now, right? So we want to see those trends, right? We're increasing, but the question is how fast? And we have the ability to change the trajectory of those trends so that it doesn't go as fast. We can flatten the curve. Again, it's always that action to how can we flatten the curve as we go forward here. We've done it before. We can do it again. Thank you.